Okay, so I am going to start by reviewing the MAR. We are caring for Stephen, date of birth 5/19/52. He just came in for pneumonia, and we're going to go ahead and get his IV med set up. So first we have lactated ringers, 100 milliliters an hour, and then Levaquin, 250 milligrams in 50 milliliters, sodium chloride, and then our Phenergen and furosemide. So I'm going to do my first med check here. So right patient, right medication, right dose, right time, right route, right indications, right allergies, and right to refuse. So I've got my 2 IV meds. I'm going to set those to the side. I'm going to sanitize my hands and put gloves on. I'm going to take an alcohol swab and scrub the hub for 15 to 30 seconds. 16, 17, 18, 19, 20. So the order is for 25 milligrams in 1 milliliter, and we need 25 milligrams, so that would be 1 milliliter. So I'm going to get my 3 milliliter syringe. Open this. Go. Alright, sterile. And then I'm going to aspirate 1 milliliter of air. Up. It's literally empty. Okay, scratch out. That one's empty. I didn't realize it. So we're gonna scrub the hub here, 15 to 30 seconds. Again, 1 milliliter of air. Inject that. And then we're gonna drop, whoops, and then we're gonna drop our 1 milliliter. Okay, we're gonna recap that. And we're gonna do the same for, actually first I'm gonna label this with my initials, date, time, medication. This is the Phenergen, probably saying that wrong. That's gonna go here. And then I'm going to do the same thing for my furosemide. So it's 40 milligrams and 10 milligrams per milliliter. So that means we would need 4 milliliters. So I'm going to get my furosemide. And I'm going to use the same alcohol swab just to not waste, but obviously I can grab a new one. 26, 27, 28, 29, 30. And then going to draw up 4 milliliters of air. Inject that in here. This might be a little difficult, blood pressure. and then we're going to recap that as well. And here is where I'm going to do my second med check. So we got our right patient, we got the right medication, right dose, right time, right route, right indications, right to refuse, right allergies, and right expiration date. So I'm going to gather all my things and I am going to head to the patient's room. All right, I'm gonna knock. Hello, my name is Jane. I am going to be your nurse today. I'm gonna go ahead and start your IV meds that the doctor prescribed for you. So can you please verify for me your first and last name and your date of birth? I'm gonna wash my hands, I provide privacy. Great, and any allergies I should be aware of? Okay, awesome. So I'm going to review the MAR and I am going to go ahead and start by flushing your IV line that you already have, just to make sure there's no extra medications or anything in there set up that would give you an adverse reaction or anything like that. All right, I'm gonna scrub the hub of this again, obviously with a different alcohol swab, but just to not waste, we're gonna use the same one. And then I'm gonna take my flush. And we're gonna go ahead, this is clamped, so we're gonna go ahead and unclamp it. And I'm gonna go ahead and flush 3 of 5, checking up here for, just to make sure that it runs good, there's no irritation or swelling. 1, 2, awesome. Okay, I'm gonna take that, recap this, recap that. And then I'm gonna go ahead and get my primary line started. So I'm gonna take my tubing, whoops. Make sure this doesn't touch the ground, obviously. This is all whacked. Okay, I'm gonna check my tubing. This is clamped for now. Okay. And I am going to spike the bag. Okay, and I'm going to hang this. I'm going to prime my tubing, unclamp. Okay, get some drops in here. Squeeze it a little bit. Might have to take the cap off. There we go. All right, I'm gonna clamp that. And then I'm gonna go ahead and get this set up. And then I'm going to scrub the hub of this again for 15 to 30 seconds, wherever this went. There, I'm gonna take this cap off, and I'm gonna let my patient know that this is lactated ringers, and it's just to help them get some extra electrolytes and fluids and rehydrate. So go on. There we go. I'm gonna clamp this for now. And then go ahead and program this. So actually, this is when I would do my third med check. So I'm gonna do right patient, right medication, right dose, right time, route, indication, right to refuse, allergies, all that good stuff. So this is it LA for
the lactated ringers?
or is it
LR?
LR?
Or it should be maintenance fluid.
Oh, that's right.
It's okay, I was doing the same thing.
That's okay. Okay. It's IV. Just for. Okay. So this is 100 milliliters an hour. And so the volume of the bag is 500, so I'm gonna say 490 just so that it calls me back before it completely runs dry. So 100 milliliters an hour. 490. Okay, I'm gonna make sure that my tubing is unclamped and there's no kinks anywhere. All right, that looks good. And now we're gonna go ahead and program our secondary. So I'm gonna go ahead and stop this, and I am going to do my third med check for my secondary. So right patient, right medication, right dose, right time, right route, right indication, right to refuse, right allergies, all that good stuff. So I'm going to take my secondary tubing and I'm going to scrub the hub of this for 15 to 20, actually before I do that, take this down, get one of these. We need to make sure that our primary is lower than our secondary. So then I'm going to take this cap, spike this here, and then new alcohol swab, obviously, and scrub this. 17, 18, 20. Hook this up. And this, I'm going to tell the patient that this is their Levaquin and this is an antibiotic. I'm going to back prime. Make sure this is unclamped. And the drops are flowing into the Levaquin, so that looks good. we're gonna go ahead and program our secondary. And this is Levaquin, 250 milligrams. We're gonna go ahead and confirm that. And that is running, that looks good. All right, so now I'm going to administer the push medications, and I'm going to let my patient know that for that promethazine contraindicates with Levaquin, so we are going to go ahead and stop this infusion. And we're going to disconnect. Well, first we're going to clamp the IV. Make sure my patient's feeling okay. And then we're going to disconnect this. And I'm going to make sure this doesn't touch the floor to the best of my ability, but not a lot of space, so no promises. I'm going to take my alcohol wipe, scrub the hub. 27, 28, 29, 30, and I'm going to go ahead and grab my flush. And I'm going to let my patient know that we go ahead and flush just so that there is no like remnants of the medication left, because we don't want the Phenergan to contraindicate with Levaquin. And I'm going to let my patient know that this is for nausea. This patient was reporting some nausea. All right. Flush that with 5 milliliters. So I'm going to go ahead and uncap that. And I am going to grab my 1 milliliter of Phenergan, and I'm going to do my third med check here. So right patient, right medication, right dose, right time, right route, right indications, right to refuse. So this is still sterile. This is sterile. I'm going to take this off and go ahead and hook to here. My needle goes in the sharps container, obviously. And I am going to push this over 1 minute because it's 1 milliliter. So push a little bit. And I'm gonna ask my patient, let me know if you feel any like tingling, numbness. Let me know if there's any redness, anything like that. Okay. So it's been 1 minute, so I'm gonna go ahead and take that. I'm gonna re-scrub my thing, 27, 28, 29, 30. I'm gonna grab my flush again. And I'm going to make sure to flush at the same rate that I pushed my med in. So then, nice and slow, mill a minute, 1 minute, another minute, another minute. All right, so now that that's done, we're gonna take that off and we're gonna get ready to do the last one, which is the furosemide. So furosemide is also a contraindication with your Levaquin, so that's why we're doing it separately. And your furosemide is your diuretic, so you might notice some more fluid, or you might notice like yourself going to the bathroom more. And then I'm gonna take this, scrub the hub, 7, 28, 29, 30. And since this is 4 milliliters, we're gonna go ahead and push a milliliter a minute. Once again. So we're gonna go 1 minute. And then just having the patient tell me if they feel any tingling, numbness, rash, itching, anything like that. Push another mill. Another, and last one. All right, so now that we're done with that, go ahead and scrub again, 29, 30, and then we're gonna go ahead and get ready to do our last flush. And we're gonna flush at the same rate, again, 1 ml a minute. Another minute. Another minute. Another minute. Good. All right, and now that that's done, I'm gonna go ahead and scrub again, and we can go ahead and restart the antibiotic and the sodium chloride infusion. So I'm gonna clamp that, hook my tubing back up, and then I'm gonna let the patient know I'll be back to check on them in 15-20 minutes. We're gonna go ahead and run that, and then I'm going to put my stuff in the sharps container, which I should have done earlier, get all my garbage out, and I'm gonna ask the patient if they have any questions for me or if they're feeling okay, and let them know that I will be back in about 15 minutes, and I'm going to go document the meds that I gave and the rate and the route and all that good stuff. And before I leave, I'm gonna take my gloves off, wash my hands, make sure my patient's bed is low and locked and that they don't need anything and that they have their call light next to them. And see.